ওয়েল মাই ফ্রেন্ডস, আজ অনেক কেস ছিল দেখানোর মতন। টুডে আই হ্যাড মেনি কেসেস, বাট ডিউ টু রাশ অফ পেশেন্টস I couldn't show many videos. In my clinic, you should observe the time is now 9:20 p.m. And the time 9:20, I started my clinic from 8:30 a.m. and now about 9:30 p.m. So still there are 20 patients are waiting. So that's why I couldn't able to show many videos. But this video is very important. This case, this patient is essential to demonstrate. I have decided. So I do like to show this video. So I like to present this video, my friends. My subject is a 24-year gentleman, a shopkeeper of Malda town. He is having 24 years age, has been suffering from bronchial asthma. And the peculiarity of this bronchial asthma, he has been suffering for this bronchial asthma last 22 years. He is having now 24 years age, but it had started when he was at the age of 2. So since childhood, he has been suffering, for which he had consulted a number of allopathic pulmonologists, physicians belongs to respiratory diseases consultations. And they have given some antispasmodic medicines of the respiratory system and some inhalers. Still he is continuing that. And after hearing my news, he has come and consulted with me today. What will be my prescription? The prescription is as very hard as very easy to me. Why I have told it is very hard prescriptions? Because the symptomatology of this patient is very difficult to find out on similibum. And very easy to me means I have grasped the peak points of the case and I have selected the correct or exact or the similibum medicines. Now, what are the points I have grasped? See, this is the case. Asthma, bronchial asthma since childhood. Present age is 24 years. The asthma is for last 22 years. He had stones in the right renal and left renal. He had stones in the right renal, but it has reappeared and now bilateral renal stones. Right-sided stone is 2.4 millimeter, left-sided 2.9 millimeter. This dyspnea or respiratory distress starts with tickling cough, with tickling sensation in the throat. No other symptoms is found except some drawing sensation of the head as if his head is sometimes drawn back. Past history jaundice, vaccination taken many times, especially he had taken the corona vaccine 3 times. In the family history there is cancer. Maternal grandfather had died with cancer. Catches cold very easily. Catches cold very easily. Sweat offensive. Appetite poor. Desire for meat. So, I have told you, very difficult to come into the conclusion. কোনো পার্টিকুলার মেডিসিন সঠিকভাবে পাওয়া যাচ্ছে না, কিন্তু আমি ভেরি ইজিলি পিক আপ করে নিলাম দ্য ফিজিক্যাল মেকআপ অফ দ্য বডি, টল, সিলিন্ডার, ন্যারো, হ্যান্ডসাম বয়, হ্যান্ডসাম ইয়ং ম্যান, and appetite poor. In this case, in this subject, it will be normal for normal appetite or excessive appetite. Appetite poor means some disturbance into the system. When system disturbs, it may be due to dynamic or silent tubercular infections. Mycobacterium tuberculosis may affect in any organs in any parts of the body. When the organ changes, antimonium crudum, etc., when the side of the body changes, laccanalum natramur, when the system changes, tuberculinum is the medicine. So there may be systemic defects and catches cold very easily. সর্দিটা তোমার চট করে লেগে যায়, ক্যাচেস কোল্ড ভেরি ইজিলি, অ্যাপেটাইট পোর, ডিজায়ার ফর মিট, মাংসটা একটু ভালোবাসো, ডিজায়ার ফর মিট, অ্যাপেটাইট পোর, catches cold very easily, and the physical makeup inspired me to prescribe tuberculinum. But as the tuberculinum is not made by HAPCO, the reliable company on which I have enough faith, they have not prepared tuberculinum in 50 millisimal, but they are preparing basilinum in 50 millisimal scale of potencies. There is no difference between tuberculinum and basilinum, not so much difference. So I do like to prescribe basilinum in 50 millisimal scale of potencies, 1 to 3, 4 ODM, that means once daily in the morning. So that's why I have told that it is very difficult in this case to pick up a similar medicine because there is no easy totality, easy symptomatology. But if you have the acumen of the mind, acumen of the brain, rationality, proper judgment, judicially and rationally, you may arrive at your goal. That means to prescribe on correct medicine on considering the prescribing symptoms, physical makeup, lean, not lean thin, but standard physical makeup, and the lips are red to some extent, tuberculinum, belladonna, lachesis, sulfur. Lips are red, handsome body, tall, handsome body, desire for meat. Catches cold very easily is very, very important. Catches cold very easily, appetite poor. So let's prescribe tuberculinum, but as it is not found in 50 millisimal scale from the reputed concern, I have prescribed basilinum, and let's see the result. I shall share you, my friends. So this is called the art of prescribing. You should pick up, you should firmly grasp from the totality of the case, from the totality of the patient. It seems it is very dry and uninterested subject to pick up the correct one from the totality, but my experience tells it is very easy, very simple, very systematic. If you know the proper rule, proper clue, you can apply, if you apply your proper intelligence and acumen. So let's see the result. I shall share you the result of this young man's case, my friends.